When you log in for the first time, it will take you to the dashboard. The dashboard has mainly three areas. 1. Side menu. This menu helps to open any page related to the selected patient. 2. Main menu. It has Home, Reports, and dedicated buttons for new patient registration and appointments. This menu also includes the check-in and appointment counters. Then, Settings. 3. A user-specific area to manage logged-in users. Now let me take you through the workflow. We have basically three types of patients. 1. New patients. 2. Walk-in patients without appointments. 3. Patients with appointments. Let's take the first case, the new patient. To register a new patient, click on the New Patient button. Enter all the required information. The must-have details are first name, gender, age, and mobile number. After registration, you may go directly to dental charting by clicking the Proceed button. In this demonstration, we are using the check-in feature. Once the check-in is clicked, we need to enter the reason for the visit, preferred doctor, and operatory for the treatment. The check-in counter increases based on the number of check-ins. This informs the doctor regarding the number of patients waiting in the reception. To get more details, you may click on the number. It will give the patient details, the treatment, and how long they are waiting. Check-in is a great tool, which helps the doctors to prioritize patients based on different conditions. Let's take the second case. Walk-in patients. Imagine one registered patient has come to your clinic without an appointment. To do the check-in, search and select the patient. The search can be done using the patient name, registration number, mobile number, or ID number. Once the patient is selected, click on the check-in button. Enter the required details, and click on check-in. Now let's take the final type of patient. Patients with pre-scheduled appointments. Let's learn about appointments before doing this type of check-in. To open appointment page, click on the appointment button. This page will have the doctor's name on the top and time on the left side. To give an appointment, click on the blank space in the scheduler. It will open an entry page. If you want to give appointment for an existing patient, search with patient details. If it's a new patient, such as a new telephonic booking or an online booking, then mark the checkbox for temporary booking. Let's start with an existing patient. While giving appointment, you may notice a right arrow mark on the top. This option will help you to understand the patient's pattern towards their past appointments. The treatment plan section helps to give appointments quickly from the created treatment plans. Now let's give an appointment for a new patient. The appointments are differentiated by the font color. As you see, all the appointments are color-coded. The top color represents treatment, the body color represents status, and the bottom color represents doctor. The scheduler has facility for rescheduling by drag and drop. Also, we can adjust the appointment time by dragging. For a quicker movement through various dates, we have a small calendar on the left side. It has facility to watch the calendar in week view, or month view. The default day view can be changed by clicking here. Depending on your style of practice, you may set operatory view, or Dr. Wise view as your default view. The settings under the Manage helps you to customize the appointments. In the Status section, you can set preferred colors for each status. In the Doctors section, you can prioritize the doctors by dragging. This will alter the doctors columns in the scheduler, helps you to keep the main doctor in the first column. You can also set the colors for each doctor, which helps you to visually recognize the appointments, especially in the operatory-based view. Just like the previous section, the operatory section also have a dragging facility to prioritize. The set sequence will be reflected in the operatory-based view, which will help you to keep the busy or main operatory in the first column. You also have option to add or remove operatories. We have few more wonderful tools in the Manage section. The waiting list is a great tool to manage the rescheduled appointments. If any patient is not able to come for an appointment, you may move their appointment to waiting list. To do this, just right-click on any given appointment, go to Move, and select Waiting List. If you open Waiting List, you may find the moved appointment. If the patient is ready for another date or time, just copy the appointment and click on the available time slot. It will copy all the information to the new time slot. This ensures that you are not losing any appointments. The recall is a great tool to manage the patient's recalls. To add a recall, just select a patient and add the recall duration. You can also use Custom to select a specific date. If you want to get the patients with recall due, use the Filter option. After communicating with the patient, you can give an appointment by copying from this list. This Recare program will definitely increase your client base. The Time Checker will help you to find a suitable time for the appointment, based on various conditions. Imagine a patient is free on Thursday and Friday, only in the evening. Using this tool, you can find the availability of the doctor on these conditions. You can give appointment directly from this screen. This will drastically reduce the time to find a suitable time slot. Dent software has reminder mechanism through SMS, email, and manual call. The SMS and emails can be configured in Settings, Clinic, SMS and Emails. You may choose the type of SMS or email that you want. If you follow the manual reminder, you may right-click on the appointment and call the patient using the given phone number. Click on the patient image to get the profile page, so that you will get more patient details on your fingertips. If the patient confirms the appointment, then you may change the status to confirmed. Note the color change on confirmation. If the patient has arrived as per the appointment, you may mark check-in. Start treatment is an optional feature which doctor can mark, so that we can understand the current status. This will also help you to get some great analytical reports. You may navigate to any page using the buttons at the bottom. The dental charting can be started by selecting one of the patient. The patient can be selected from any of the desired areas, such as patient search, appointment page, or from the check-in. We highly recommend to use check-in feature by the receptionists so that the doctors can understand the status of waiting patients, and they can easily pick the patients. In this demonstration, let's select a patient from the check-in list. The selected patient's details will be shown on the left side. Before starting the charting, you may mark the medical alerts. To mark alert, click on the alert button. Give tick mark in the boxes which is relevant, and enter the data, if required. The alert will start flickering if there is any data present in the alert pages. You can also use general alerts to mark anything which is not a medical complaint. To open charting, click on the Dental Chart button. You have options to mark full mouth, arches, quadrants, tooth, or surfaces. Dent software is programmed to show the type of the chart based on the patient's age. However, you may change the chart by clicking on the type. If you want to follow a different tooth numbering, like universal or Palmer, you may change it in the settings. Now let's do a planning and treatment. To create a new plan, click here. To enter diagnosis, there are two options: Search under All and Favorites section. The All section shows all the diagnoses in the software. You may create a set of favorite diagnoses by selecting it from the drop and clicking on the Add to Favorite button. Let's mark some diagnosis for this patient. Assume this patient has an impaction on tooth number 28. Select the tooth. Search for impacted tooth, and click on Add. You can see the change in the chart, as well as you can see an entry in the grid. Since we have already added some diagnoses into favorites, we are going to use that. Please bear in mind that only surface diagnosis will be shown on the tooth surfaces. Now the diagnosis entry is complete. Let's mark the appropriate treatments for the entered diagnosis. To add the treatment into plan, click on the blank box under Treatment. The treatments can be selected from the list, or you may use the favorites. If you want, you may change the name of treatment, rate, duration, etc. in the settings. Select a treatment which is relevant to the diagnosis. Let's mark treatments for all the diagnosis. You may notice that the rates are coming automatically from the treatment settings. If the patient has insurance, then the insurance and copayment will be displayed here. You may give discounts using the discount section. You can also change the doctors based on the specialty. The treatments can be prioritized using the up and down arrows. On the right side, you have option to decline a treatment or refer the treatment to some other hospital. Let's save this plan. A great feature in Dent software is its ability to create multiple treatment plans. Let's assume this patient is not agreeable for the implant, being its high cost, and they want an extraction instead of root canal treatment. Let's make the changes now. Click on Save as a new plan. This will create another plan. Click on Plans to see the created plans. If you can convince the patient on the best treatments, we can go ahead with Plan 1. If the patient insists for Plan 2, we can go ahead with that. Let's assume the patient agrees for Plan 1. Now we can remove the other plans by clicking the Delete button. But we recommend not to delete. Alternatively, you can make it idle by clicking the Live button. This will keep a record of all the plans that you suggested for a future reference. That completes the planning. Now let's do a treatment from the created plan. Once you have completed the treatment with patient, just click on the Execute button. You may notice the change in the chart and status in the grid. Click on the clinical notes to enter the details. Click on the Save button to save the treatments. To see all the past treatments, click on Show All History. The billing can be accessed from the left menu. Click on the billing. It will show all the past transaction and the fees from the dental charting. To collect a payment, click on the new transaction, and enter the required details. The invoice can be printed using the Print button.